Good morning and welcome to the Hawai'i Health Data Warehouse Coffee Break monthly webinar series. My name is Tanya Lowry St. John, and I'm the Public Health Epidemiologist with the Hawai'i Health Data Warehouse, or HHDW. We're going to use the next 30 minutes to review the basics of our Hawai'i Health Matters site and how to use it to find the information that you need. The Hawai'i Health Matters website was introduced to the public in 2009, and it's designed to provide a user-friendly way for users to access and interpret health data. It's built on the platform that's maintained by Conduit and Healthy Communities Institute. They provide the infrastructure and maintain some of the indicators, but we maintain the bulk of the indicators on the site. HHM houses over 700 indicators from over 50 different sources. So while it does include a subset of data that's collected in Hawaii by the Department of Health and made available to you through the HHDW site with our powered by IBIS, it also includes Hawaii data from a variety of other sources. So the reach of HHM is broader than HHDW, and it includes measures of community health as well as population health. So it's a little bit of a wider place to start. Because the data comes from many different sources, it is updated asynchronously as the new data becomes available by source. So if you're looking at data on a particular topic, the data may be from different years by indicator, depending on the data source for each indicator. While HHM was originally designed with state and county data in mind, almost all indicators have data for both. Many have actual indicators by other demographic variables as well, like age, sex, and race ethnicity. Increasingly, HHM data is now available at the sub-county level, all the way down to the census tract level for some indicators. When we're thinking about indicators, it's helpful to think of them as separate objects or books within a library. They can be viewed individually, they can be grouped in the form of a pre-made tracker, which is a selection of related data that we've created for you, or as a hand-picked tracker that you can create and share. And we'll go over all of those today. Before we get into the site, I want to quickly review some of the icons. For those of you who have set in these before, you might remember that red is bad, green is good, and blue is neutral. So we try to use visual cues in the forms of colors and symbols to help you interpret the data point that you're looking at. Solid trends are usually statistically significant, so this would be a solid trend. Mostly white trends are not statistically significant. When you see check marks, it means that the target has been met, and X's as the target has not been met. And when you see a gauge, then that means the data in your indicator is compared to all states or all counties, depending on what you're looking at. So for example, here, if we were going to interpret this data about children living below the poverty level and people 65 and older living below the poverty level, we can see we have the point estimate, 11.9 and 8.1%. And we have the time frame when that data is collected, that's in parentheses below the point estimate. So we'll stick with this one, and we can see that compared to the United States as a whole, Hawaii is in the top 50th percentile in terms of children living below the federal poverty level. We're doing well. We are lower than the US value as a whole, which is 18.5%. It's a down arrow because we're lower, but it's green because it's good that we're lower. And we're about the same as the prior value. So if we compared our Hawaii data to the previous year's data, the value is the same. It is a trend that looks like it's going down, but it is not statistically significant. And it's good because we want to have fewer people, fewer children in poverty. When we're looking at the seniors in poverty, we have it's 8.1%. We're still in the upper 50th percentile of all the states, but the US value is 9.3% and we're at 8.1. We're lower, and that's good. It's about the same as the prior value, but this is a trend that's going up over time, and it's red because that's bad. I wanted to also show you some other indicators or some other symbols that I want you to be looking for as we go through the site today. Sometimes you're going to see information in orange boxes with this little caret or triangle pointing down. These boxes, when you find them, apply a filter to the data that you're looking at. So in this case, we would look at our data and we would filter by location. And we'll get into that in the demo. When you see blue triangles in the site, then that allows you to change that information. So in this case, you could change the place, which is in Hawaii. You'll see blue triangles by time period, so you can change the time period you're looking at. And you'll also see the blue triangles by the indicator, so you can change the indicator that you're looking at. So those are something to look for. When you're hovering over graphs, you're going to see this 3-bar icon, and it appears in the upper right quadrant of a graph. And when you see that, you can click on that to either modify the information in the graph, how it is displayed, or to download that graph, either as a picture or the data that's underneath it. As you scroll down into an indicator page, you will often see this sort of list that goes across the side, and it's going to depend, it will vary on your indicator and the data that's available for that indicator. But when you see that, that means that there are indicator information for this indicator in these locations. So this is one where we have data at the state, county, primary care service area, census place cities, zip codes, and census tract level. So by clicking on one of these, then all of a sudden you're viewing your indicator of interest in that geography of interest. And we'll get to that in the demo as well. The other thing, last one I just wanted to remind you, is that when you see these little up and down arrows, those allow you to then sort the data in a table. So when you see that, that's another place that you can click on. I invite you to open up your browsers and follow along and click as we go, because you'll get a lot more out of the site if you're actually touching it. You cannot break it. This is what it's for. Okay. So let's go ahead and go directly into the sites. Okay, so again, to get to our Hawai'i Health Matters site, you can click here on the green box on our screen, or you can also come up here to hawai'ihealthmatters.org. You can also just enter hawai'ihealthmatters.org directly into your web browser, and you'll come to our site. And as we've covered in the past, we have this rotating featured content, for which reports we also will keep in our resources and tools library. We advertise the latest data sets that have been loaded into HHDW, and of course our coffee break series. And we'll give you the preview for next month at the end of this one. We also have a little bit of a dashboard here that's going to be related to our featured content, which just sort of gives you ideas. Oftentimes, if you've been at the site, you're like, well, who knew they had data on that? So this is just another way to kind of look at information. I'm going to start today here at our resources and tools section. So I just want to show you a couple of things to remind you as you're going through and doing your research. One is that we have a very large report library. We go through and we are combing through reports. If you have reports that you would like us to put up, please send them. We are all about putting up Hawaii specific data. And in this resource library, you can go through and you can search for information within our collection. So let's say if we want to search today on violence, you can search by a keyword. And then it gives you tips for using your keyword search there. So there's always tips embedded throughout the site. Hover and take advantage of those. And you can see that we have 98 results that are related to violence. So they might not be directly related, but the violence is a keyword that was associated with the topic area for those resources. And you can come through and we can filter it. You can filter on the resource type, on the subtopics, you could look at it only one within a certain date range or location. So this is another way, again, those orange boxes apply filters throughout the site. If you have data that you would like us to put up on the site, or you'd like reports you'd like to link to, you can always click here to make that happen. We would love it. Again, we're always looking for new content. We feature something every month, but we load many more than 12 reports a year. Coming back to the resources and tool page, I just wanted to make you aware again of our promising practices. So this is a database of public health practices of over 2,353 right now, practices for community health. So when we're talking about, let's say I'm interested in community weight loss, it's not the diet that an individual could take, but these are going to be community-based weight loss interventions that have been used in different places around the country. So the Conduit platform is a nationwide platform, and so we share information with health departments, state and local around the country, and local organizations that are doing good things. So again, here, if I wanted to go into a keyword search, and since we did violence before, I'll do violence again and say, well, are there public health practices there around violence that I might be able to look at? And you can see that this gives you 179 different results of community-based promising practices in the area of public health. All of these results are peer-reviewed by a panel, and then they are ranked in terms of being evidence-based, effective practice, or good idea. You can have information about our ranking methodology here. And then also, if you hover over on these as well, it gives you for additional information. And if you click on one of these, it will take you to a description of the program, as well as information and contact information if you want to talk to the person that did the program to learn more about it. So that actually it's really meant for public health professionals who are trying to institute programs in different locations. And you can see they have practices that are focused by the CDC. We have some local practices as well, and they'll be linked with a local icon. And if you have a promising practice, your group has been doing something and you want to get some publicity about it, you want folks to be able, you want to have it peer reviewed by an external group, so that gives you credibility, and also to have it shared with folks here in Hawaii and people who use the Conduit platform across the country, please go ahead and submit a promising practice. So the next thing I want to just briefly touch on is our tracker area. So we did trackers last month when we focused on our Healthy People 2030 trackers. And so again, as we're thinking about our health indicators, our trackers are pre-curated groups of indicators that we've put together around a certain theme. So we've put together indicators around Healthy People 2030. The primary care needs assessment had a group of indicators that they looked at. The tobacco use prevention and control will be working on helping them with their new tracker coming forward. But basically, when you click on one of these, what you'll get is that basic information about the tracker, why we're interested in this topic area, who put it up, what their major goals are, and you can go down and you can get information about a whole list of indicators of information related to this topic in our system. As you're scrolling on these, you can see that they light up. So again, I like to think of it as a book on a shelf. You can pull that off and then take a look and examine this more closely. And we'll do that in just a minute. And you also will see the information to help you interpret the data that you're looking at. So for example, state tax on cigarettes, what it is in Hawaii, what was the prior value, what the trend is over time, what our goal is. So the goal was $4.10. It has not been reached, so it's an X. And what the Healthy People 2020 goal was, which was also $4.10, and that has not been reached. So again, it's this information, a collection of the data within the warehouse, thinking about those slices of those 700 different data. All right, so now we're going to spend a bulk of our time here on this, are finding the data in the community dashboard. We've done some previous webinars and looked at the Socio Needs Index and the Food Insecurity Index. Those are on our YouTube channel. But all of this information is really going to sit in our community dashboard. So let's go there. In the community dashboard, when you look at this, you can see that all the trackers that we've talked about are also displayed in here. So you can look at them by that. You can look at a list of all of our indicators that we have by location. You can pull up a dashboard of all of the indicators that we have in the system. And you can also search by keyword, which we'll do in a second. We've done building a custom dashboard in past webinars, so we have one available on that. But I want to remind you again of these little drop-down boxes in orange. So in here, we can go through and filter what we're going to look at. So I can go ahead and say, I want to find an indicator. So if I went ahead and looked at violence, so what you need to know when you're using this filter is these are on words. This is not a keyword. These are words that are actually in the title of that indicator. So I can go ahead and just start typing in there. And that is one way to begin to limit the indicators that I'm looking at as I'm trying to hunt and peck and find one. Another option that I can do is if I'm interested in a particular location, I can filter by location. So I can, if I'm not sure what locations that we have within HHM, one of the things that I can do is I can click here on the use the map to select a location. So this brings us to our map of Hawaii and the geographies that we have available here in Hawai'i Health Matters. So I can see here is the county. So I can scroll over and there are my counties. I can see primary care service area. And I can go ahead and get in there and look and say, all right, well, I'm really interested in this area. This is the primary care service area. That's Waimea. Do they have census data available here? So I can go through and see where, if I'm looking at census place, this is what it's going to be for the data for my location, zip code, and all the way down to census tract. So this little feature is a neat way to go ahead and look at certain data. So let's say I want to use this and say I want to just look at data in Lihue. And this will pull up a custom dashboard that it just built for me with all the data that we have in this website on the census place Lihue. And I can go through and I can see what kind of data that we have available just for Lihue if that's what I'm interested in. So this is a neat feature. If I like my dashboard when I'm done, I can always save a link to this search, and I can use this to pull up this dashboard again and again, and the data will be refreshed as it's refreshed in the system asynchronously. So I'm going to go back real fast and take a look here at our keyword search option. And I'm going to do a keyword search here by poverty. And this is now, it doesn't necessarily have to have poverty in the title to appear here. It has to have a related keyword that's related to poverty. And I can go and I can see again that we have a lot of information in HHM regarding poverty. And so I can click on one of them at a time and open them up, or I could also again say, we'll show these on a dashboard. And that again will create this custom dashboard for you with all of this information. And I can say, oh, maybe I don't want to see everything, so I can filter. I want to just see the data for Hawaii and run it again. And now I can look at the data that we have that's related to poverty for Hawaii. If I can also go up here through this list and just pick the ones that I want and then winnow down my dashboard for something that I want to look at. And if I like my dashboard again, I can go ahead and save it. I can also say to show me data by subgroups. If I only want to know data that we have by age, I can put that information in here by our different subgroups. So for example, if I quickly wanted to make a dashboard on sexual orientation, I could come and create one of these and just do sexual orientation. It would give me all the data in the warehouse that's available by sexual orientation, okay, or in this platform. So I'm going to go ahead and scroll down here on this, and I just really wanted to point this out to you because I think this is more powerful than most people realize. So I'm going to go ahead and scroll down on here, and I'm going to take a look at our child poverty rate that we looked at before. So children living below the poverty level. So now I'm going to click on the indicator itself, and this will bring me to the standard indicator report. So again, what starts off with is what it is. This is where we're looking at for the state of Hawaii for the period of 2015 to 19. This is what the definition of that indicator is. I see these little blue triangles, so I can click on them if I want to change the indicator, if I want to change the measurement period, or if I want to change the location that I'm looking at, I can do that here. Scrolling down, I can see that the point estimate is 11.9%. The data source is the American Community Survey. I have all those gauges again. If I can't remember how to interpret them, I can hover over them, and that data is available there for me to help me interpret what those symbols that I'm looking at. And I can see what this data looks like over time. I see those 3 bars. I can decide to hover over that and say, well, why did they say it's not a statistically significant trend? Because it looks significant. Well, I can enable the zero-based y-axis and go, oh yeah, that's not significant. And I can go ahead and I can put the confidence intervals on that. And if I like this graph, I can either download it as a JPEG or a PDF, or I can download the data in the graph as a CSV. And I can do that with all the graphs that are going to appear in this system. I can go ahead and click on my view by subgroup information. And again, thinking of our color scheme that we talked about with red being bad, blue being neutral, and green being good, we can see that for children living below the poverty level, those who are less than 6 years old, it's 13.3% compared to the state as a whole, which was 11.9%. I can throw those confidence intervals in there if I want to see it to make that more clear. There's no difference by sex, but if I go and I look at by race ethnicity, I can see, yes, there's definite differences where Hispanic and Latino children and Native Hawaiian and Pacific Islander children were much more likely to be living below the poverty level than the state as a whole. And white, non-Hispanic, other children, Black, African American, and Asian children are less likely than the state as a whole to be living below the poverty level. I can scroll down here and then I see, oh, this data is available by county, census, zip code, and census tract. Can also make those changes up here. But if I want to take a quick look at the data by county, I can see that in Hawaii, people in Hawaii County, it's 22.9% of those children are living below the poverty level. And if I want to go ahead and compare that to the state value as a whole, I can compare it to the US counties as a whole, the state value, the US. So these comparisons appear. And again, I can go ahead and click on here and download this data or download the chart. And this tool set, whenever I hover over one, the appropriate information appears on the other 2 graph in the chart. And again, these can be sorted. So here we can look at the data for the county, but let's go ahead and dig a little bit deeper. And if we look at the data by census tract, you can see in terms of there are census tracts that have higher levels of child poverty regardless of. So let's go ahead and I can filter up here. And let's say I really want to just filter in, and let's take a good look at what's going on in Maui County. And now I see what it looks like in Maui County, and I can compare it to either the US census tracts as a whole. So where you couldn't see before, there are 2 census tracts in Maui County, which are in the worst quartile of all the census tracts in the United States. So there's a lot of data in the system that you can go through. And if I keep scrolling down, I can see then this compares me all the census tracts in Maui County. It tells me what the lowest and the highest is, and the median and the quartile. And scrolling down again, then it relates these indicator of children living below poverty to other health indicators, to reports we have in the system, data resources, funding opportunities, and other resources and fact sheets. So these are all places that you can look and click on to really be able to dig deeper into the data. So I'm going to put up the activity so that you guys can take a look at that and run through that. Okay, so the first question was, how many trackers are there in HHM? So if you come over to our track progress, you can just count them down this way, or you can also go ahead and look here and you can see that there are 8 trackers in HHM. We're looking at our resources and tools. The next question is, how many resources can you come up with when you search for cancer in the resource library? So I'll come here and I do a search for cancer. Again, it's a filter because it's an orange box. And I see that there's 37 results for cancer. And then I said, use a tracker to create a socioeconomics need profile for Maui County. This was kind of a tricky one. So if you go there, you've got to go to the trackers and we go through and we can say, okay, socioeconomic status. So we'll click on there. And then we have that happy orange box. So we can go ahead and say, all right, let's filter. So this is the data for the state as a whole. Let's filter it for Maui County. And now all the indicators of these have Maui County level data are now filtered. And this is what the data looks like here in Maui County. So this is just a neat, quick way to say, all right, how's Maui doing? You can then look at it by using one of the pre-made trackers and then changing on that location. The next question was, what % of adults have high blood pressure? So I'm going to come back to my Find Data Community Dashboards. And let me go ahead and try this version. I'll do adults with high blood pressure. Trying really hard to use normal language in this. And so here you see, this is the definition of what high blood pressure is and what that means. And you can see that we have this data by a bunch of different locations. So we're going to start with the state because that was the question. And you can see that in 2019, according to the Behavior Risk Factor Surveillance System, 30.7% of adults in Hawaii have high blood pressure. And the next question is, who is most at risk? So we can scroll down here and look at our data by subgroup. And we know that red is bad, so they're going to be at risk. So let's take a look. So we can see older adults, people with a lower education, so less than 9th grade, retired, unable to work, which makes sense because it's older, yeah. And then Japanese, and it's probably because of the older population, are going to be most at risk. And again, we can see this data is available by many different geographies. Your next question is, which zip codes have the lowest and highest proportions of adults with high blood pressure? And again, if you like this data and you want it, you can always download the indicator data in a CSV to do your own analysis or your own additional work with. It's not record level data, it's conformed data, but that would allow you to put it in different charts and graphs and all that kind of fun stuff. And here, if we look at it by zip codes, then we can see then we have the lowest is 9.1%. I have a typo on my slide. And then 9.3%, if you take a look at these and you look really closely, they're so low because those are located on military bases. That's part of Pearl Harbor Hickam, so a very young population and also very fit because they're employed in the military, so they are not likely to have high blood pressure. And then the next one would be, if you look at the highest, I can go ahead and do it this way, and I can see it is 38.5. And if I want to go ahead and click on that, so actually take me to this region, and I can back it up a little bit. And I can see, that's on the Big Island, right? So that's where this is. And this is the zip code with the highest proportion of the population with high blood pressure in Hawaii with using this data source. And this data source is actually from the CDC Places data. And we have that information given out here as well in terms of where the data source is. Okay, so I will stick around if anybody has any questions, and otherwise, I thank you very much for your attendance today. I want to remind you that our next coffee break is going to be on November 2nd at 11 a.m. and we are going to be showing you how to do the birth and death rate data. So we have included rates, and we had the count system was up, and the rate system will be up by the beginning of next month, and we're excited to show that to you.